welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you heard, our show is dedicated to helping you find safe, very important word, and effective, another very important word, treatments for all sorts of diseases and conditions. Other than the traditional, of course, which if you're listening to this, you wouldn't, they must have failed you. Otherwise, you wouldn't be listening to this now. We're now heard in over 70 countries around the world. In any given week, we have as many as 30 countries listening to us. In fact, I'm a Rotarian, and I thought I knew almost the names of almost all the countries of the world, attending Rotarian international meetings, and yet there's some new ones out there. Very interesting. In any case, we're going to get right to business. I'm not going to do as much of a promotion to thank my two sponsors, Promolife. Please get a pen and paper. You're going to want to write stuff down if you're listening to this show. I guarantee it. Very important. Get a pen and paper ready, because I'm going to be talking about how to treat Lyme disease in an extremely effective way. And you're going to want to know about some home care that you can do that's can be key and essential, particularly if you live in places where you can't get intravenous ozone therapy, in which case you're going to want to contact Promolife. Promolife makes home care ozone generators that you'll be able to do what we're going to talk about in your own home to help. May not get rid of it, but certainly can help a lot. And because their generators use a very special type of power plug that you can plug in virtually anywhere in the world, it doesn't matter where you live in the world. You can get this. They ship worldwide, and you can get their units for home care. You tell them you heard about it here on the show. You can call them at +1. That's our country code here in the USA. +1 866, +1 888 742 3404. That's +1 888 742 3404. And you tell them you heard them on the show, they'll set you up for home care. Make sure you get a commercial oxygen tank. It has threads that you can actually screw a garden hose on. And it doesn't matter whether you're 220, 110, like here in the US, 220 elsewhere, or 230 elsewhere in the world, you'll be able to plug their unit in because it has a voltage regulator that sends the right voltage into the machine to make the ozone. It's not as easy to get medical oxygen tanks filled anywhere in the world, but the commercial tanks filled with pure oxygen, of course, are easy to fill, and you can get them filled just about anywhere. And you can have adapters made if they don't already have one for you for the pressure reducer, what we also call a regulator. Now, I'm going to talk more about that later. And of course, you're going to hear about how important Doctor's Biome is. Please, you've got to start taking it. Doctorsbiome.com, DoctorsBiome.com. You're going to understand why it's so important. And when you use the code radio20, you'll get 10% off your first order. And if you go on auto ship, you'll get an additional 10% off your order. So this way you can get 20% off your order. So don't hesitate to do that. You go to doctorsbiome.com. Now let's get right into the show, because I'm redoing the show that we've done in the past on Lyme disease, because I want to give you the latest on what we've seen and what we know that works. And here in the USA, throughout the USA, we're in mid to late spring. Everything is warming up. It's tick weather. And this is tick season. Now, if you're living in hot areas around the world, It could be tick season year round. So in fact, before I start getting into it, let me just say I trained a couple of doctors in ozone therapy from the Republic, the Democratic Republic of the Congo. And when I asked them, do you have Lyme disease in Africa? Their answer to me was no. I asked them, did you ever test for it? Their answer to me was no. So I said, so how do you know you don't have Lyme disease? Because Lyme disease is known to be an imposter. It mimics many other diseases and conditions. You may think you have multiple sclerosis. You don't. 20% of all Lyme cases, all MS cases are Lyme disease. Study came out a couple of years ago showing that. You may believe you have rheumatoid arthritis. You may believe you have many other digestive diseases, when in fact, it's just Lyme disease, because the Lyme bacteria and spirochetes can get into any organ and tissue in your body and cause a range of symptoms that you're going to learn about. So what is Lyme disease? Basically, it's a spirochetal and bacterial infection, and it's transmitted by the Aedes ticks. They're also known as deer ticks. Here in most of the country, on the West Coast, they're sometimes called black-legged ticks. And these ticks, these arachnids, they're found in woody and grassy areas, but they're so small and light, they actually can be airborne. Literally, you can be walking around. They can, on a good, beautiful, windy summer or spring or early fall day, and unless you're living in a hot climate, then it's hot all the time. And one of these little deer ticks can be just blown right onto your head. And they walk their way down to your scalp, and they can bite, and you may scratch it and not even realize it. Take a shower, wash your hair. It's just the dead, destroyed little tick. It's the size of a, oh my God, like I don't know if you've ever seen if you know what I'm talking about when you do a number 2 pencil. A number 2 pencil comes with that little pink eraser on top. And if you look at the circle, the size of that eraser, that's the entire size with the legs of an adult deer tick. It's so small you wouldn't, and that's a big one. Doesn't take a big one to cause the trouble. So, and these ticks literally, and the number one is a spirochete, what they call Lyme disease. Why do they call it Lyme disease? Okay. Well, there's a town in the state of Connecticut here in the US where one year, many years ago, over a couple of years, actually, a couple of hundred people started coming down with a host of medical symptoms. And when they actually were able to find these, because early on testing may be accurate, they found that they all had one thing in common: an infection from a spirochete, a corkscrew-shaped like bacterium called Borrelia burgdorferi. Borrelia burgdorferi. Now, the tick would bite you, transmit this spirochete, it would get into your blood, and this all first began to be identified because it's been in existence for thousands of years. They found these bacteria in fossilized amber inside mosquitoes. So mosquitoes bit some animal or person back then, and it had in the blood that it sucked up, it had the Borrelia burgdorferi. And we know that Lyme disease has existed for at least 10,000 years because of that. And there are many different pathogens, over 15 different tick-borne pathogens that you can get just from that one tick bite. For example, in 2011, they came up with another version of Borrelia, myomotoi. And you can have a number of different infections that we're going to talk about. So, because it mimics so many other diseases, it is often called the great imitator. And since it can affect any organ in your body, from your brain to your nervous system, your muscles, your joints, your heart, your lungs, your digestive system, anywhere in your body, um, it's often mistaken for something else. And there are many symptoms, and that's what drives doctors insane, because you only have to have some of the symptoms, not all of the symptoms, to have this. And there are other infections that can cause similar symptoms. For example, you can have brain fog. If you have brain fog, you know what this is. Brain cloudiness, or brain fog, it's called. Um, Memory, short-term memory issues, cognitive issues, not understanding things that are being said, coming up with words when you need them, focusing issues, tight bands around your head. Let's see, sinus congestion, sinus problems, feeling of strong pressure in different places in your head. Not tight bands, but pressure, severe pressure in different places. Headaches, and you may not have any of those symptoms, for example, every day. They can come and they can go as the different organisms go through their life cycles. Different ones flare up. I didn't tell you all the different organisms you can get from one bite yet. From that alone, you'll get different symptoms, and it's confusing and confounding, not only to the patient, but to the doctor. Fatigue, almost 80% of the people have fatigue, probably closer to 100%. A rash, you can get a temporary rash with which looks like a bullseye from where the bite comes. Now, this doesn't have to happen, but it's definitely diagnostic. If you go on the internet and look up images of the bullseye rash for Lyme disease, you'll get a great picture of what it looks like, and you'll know. But that does not have to happen to get it. When you first get bitten, infected, you can get fever with sweats and chills. That can happen later on as well, as these organisms flare up in your body and go through their life cycles. Then they go down and they quiet down, they go into remission. Muscle pain, common in almost half the people that get it. Joint pain also. Neck pain, back pain, very common. Depression and anxiety. So it definitely affects the brain, but there's other reasons why, because of your gut, that we're going to talk about. Rapid heartbeats, sleeping problems, urination problems, digestive problems. Okay, so they have discovered that not only here in the US, but in over 60 countries, these have been found. However, I always like to joke around that, because I used to get a lot of patients from Australia, that if you want to get rid of your Lyme disease, all you have to do is go to Australia. Why? The minute you get off the plane and both your feet touch the ground, your Lyme disease is gone. Why? Because the Australian government has declared that Lyme disease doesn't exist in Australia. So I guess they're not allowed to treat it. Fortunately, I've trained doctors in New Zealand and in ozone therapy, and you don't have to fly all the way to the US unless you want to have the teacher treat you, because this is a long-term treatment for it, as you're going to know when we get to that. So not only can you get from that one tick bite the Borrelia, but there's another very common co-infections that can cause all sorts of issues from it. Over 30% of the people from that one bite will get Babesia, Bartonella. Another very common is Ehrlichia, Anaplasma, Mycoplasma, tularemia, not as common really, and Rocky Mountain spotted fever, all from that one tick bite. Okay. And of course, different ones come in different amounts, but it doesn't really matter because it's after a few years where it may have gone into, may have been sick for a few days, a week, thinking you got a summer cold or something like that. Um, uh, but fact of the matter is, in within some period of time, so, and there's different opinions about it, could be a few weeks to a few months to a few years, you'll stop showing antibodies to it. And that's one of the big problems. The testing is very poor. It's commonly said by what's called LLDs, Lyme literate doctors who specialize in the treatment of Lyme, that a positive test means you have it, but a negative test doesn't mean that you don't. And testing is so poor. The Global Lyme Alliance, a wonderful organization that raises millions of dollars each year, a not-for-profit, you should donate money to it if you have Lyme disease, is spending millions of dollars every year on research to come up with a test that can truly prove that it's gone. Many of the people that I see have been suffering from Lyme disease for years, many, many, many years. I commonly see people who have who maybe just started getting symptoms again. That means they went into stage two, um, and now most of the people I see are stage 3 Lyme. We're going to talk about that. Um, but we've seen, well, geez, well over 2,500 Lyme patients. The number grows every year. I've only seen 5 cases of I just got it with the bullseye rash, and we've able to get rid of it, we believe, quickly. But if you can't prove that it's gone, how do you know it's gone? So we have a protocol around all that. And then, of course, there's herxing and everything. So what we're going to do is we're going to go to our first break, then we're going to come back, go a little bit more into Lyme, and then we're going to talk about what you need to do to really fix it. Okay, everybody, let's get right back to it. So it's commonly thought or commonly believed that there are 3 stages of Lyme disease. I say there are 4. The first stage, when you first get it, you might get a rash, not just a bullseye rash, but another kind of rash called erythema migrans. This is they're flat bordered, blanching areas that are very red, oval patches inside these blanched areas. It can spread to other parts of the body. You might get fatigue, I said, and fever, muscle aches and pains, feel like you're getting the flu. Headache is very common then. You might have gastrointestinal symptoms, swollen vocal cords, or difficulty speaking. Your liver may become enlarged if it attacks the liver. These are all very common things, joint pain, muscle pain, all very common during the first stage. Then it goes away. And if it goes into remission, you wouldn't know you have it. You might think you just got over a cold. And that's what happens a lot. And the bad news is it can stay in remission for many, many years. Typically, I say 5 to 20, because that's the range that I see people in. Many of them first started getting sick after 20 years, and they had no clue that it was Lyme disease. Sometimes they were fortunately diagnosed with blood testing. There's DNA testing that they can do. What they don't do is look for all the different co-infections. That's something I just don't get. Why don't they? There's also an extremely good test that they use on animals. I know this because I've had a horse for many, many years, over 30 years. And one of my first horse got sick, and I knew it had to be tested. We tested him for Lyme. Sure enough, it was. And they sent out the blood test to Cornell University Veterinary School's lab. And they have a very sensitive test that comes back with titers, and it showed that he had titers. And as we treated him, and we got him well, his name was Paladin, by the way. As we got Paladin well, the titers kept coming down until they were undetectable. Here's the bad news. Here in the USA, they don't permit the test. The FDA does not permit the test on human beings. Why? It's just the blood test. It doesn't make any sense, but our FDA doesn't make much sense anyway. They are an overworked, undermanned organization that has a hard time doing their job. So a lot of what doesn't make sense is because they're overworked and undermanned, and they don't have the time, let alone the inclination to do their homework carefully. There's nothing in it for them, unfortunately, and that's why they don't spend the time on it, because they're overworked and undermanned. Now, you can get in stage 2, early on, you might get some other annular target-shaped lesions. There's different types of skin reactions that you might get. You might get Bell's palsy. It's where part of your face falls down. Listen to the show we did on it. In fact, it can be on both sides, not just one side. In about a third of the cases, it's both sides, which is kind of confounding. All sorts of neurologic problems, including an enlargement of your brain, and it can cause severe mental issues. All those anxiety, depressions, all those things that we mentioned before. You can start having the rapid heartbeats and things like that. Then in stage 3, which could take place many years later, that's when the fatigue hits, memory impairment, sleeping problems, various psychiatric problems, including irrational behavior. People can become very difficult and won't let you treat them. Very, very difficult situation. This is where it likely might get diagnosed as various forms of arthritis, often affecting the knee. But it can be any joint in your body, okay? And then there's what I call stage 4. Stage 4 is death. Lyme disease is not a life-changing disease. It is a life-taking disease, okay? It's a life-taking disease. So it's very, very disturbing, because there are answers for it. And if you wait until it's too late, it's too late. Okay. The good news is almost any method of Lyme disease will work. What we're going to talk about, intravenous ozone therapy, will work and help it very, very clearly. One of the problems in treating Lyme disease, which is usually treated initially with antibiotics, and if you're listening to this show and you know you have Lyme, you know you've had long courses of antibiotics. One of the problems in this country is it has been determined that by insurance companies that they will only pay for so many weeks of IV treatment for Lyme. Unfortunately, it can take 6 months to a year or more to kill off all these bacteria as they proliferate, regrow, regenerate, and duplicate, and spread throughout your body virtually overnight. Now, when you try to kill them off, and you do because there's so many organisms, if your body is not properly prepared, you're going to do what you're going to have is a Herxheimer reaction. Herxing, as it's sometimes called, or I had a Herx, comes from Dr. Herxheimer, a German doctor, and Dr. Jarisch, a Swiss doctor, unless I got the countries reversed. Nobody ever mentions Jarisch but me. And this is where your body builds up what they call cytokines, and you can't get rid of them fast enough. So you have this either a fatigue-like symptom from it, or you feel like in a more moderate to severe one, you have to sleep, cannot not sleep, have to go to sleep. And when you wake up, you either have an energy level that you feel like painting the house, or it takes days to return to a normal energy again. And then in a most severe H.O.C.A.T.T, which I saw again yesterday in my office, a young lady, severe H.O.C.A.T.ing. She H.O.C.s from every therapy. This is one of the most severe cases I've ever seen. In a severe H.O.C.s, you may get lightheaded, dizzy, nauseous. You probably will throw up. You're going to, let's see, what else? You may even lose cognizance of where you are or who you are or what you're doing. It can last from a few minutes to a few hours. What we've learned is the best treatment for it is some oral vitamin C. We use a liposomal vitamin C capsule for that, and along with oxygen by nose. And of course, you can't do this at home. This is when it's being done in a doctor's office. H.O.C.ing is extremely common. Almost everybody is going to H.O.C.s from it. Now, supplements. Do I want to get into that now? Let me just start saying, taking antibiotics is, if you have to, is okay. Keep in mind that IV antibiotics are probably the most effective. Oral antibiotics can be very effective. I just don't use them. Most of the patients have already had them and have all the good boys in their gut completely destroyed by antibiotics. We do, as you know, intravenous ozone therapy, and we're going to be focusing on that. But intravenous ozone therapy is the way to treat this from what we've seen in the most effective way possible and the safest way possible. And of course, we have to replenish the good boys in your gut. The way we replenish the good boys in your gut was with the product of our sponsor, Doctor's Biome. Doctor's Biome Gut Health has 15 patented strains of probiotics that are created. They're called next generation bacteria. They're created to survive the stomach acids and bile salts. So capsule, powder, and tablet probiotics are destroyed over 90% in your stomach. They're almost worthless. There's reason to believe they are completely worthless, but I'm giving you the benefit of the doubt that they're almost worthless. Well, Doctor's Biome survives the stomach, and then they've also been chosen to have another feature called smart probiotics. This means they were also created not just to survive the stomach as next generation bacteria, but as smart probiotics. They have been created to stick to the wall of your gut. And this helps get rid of bad bacteria like Lyme that are living there. So they're fighting Lyme actively. Repair the gut wall so you can absorb all the nutrients that the Lyme literate doctors are giving you to take to cleanse, detoxify, and boost your immune system, which is what intravenous ozone does. So it's considered that the biggest percentage of your immune system begins in your gut. Some say 70%, some say 90% of the immune system is in the gut. In any case, how can you have an effective strategy to fight this infection that can take your life if you don't have a healthy gut? Now, you can buy Doctor's Biome, and when they have it available at various times as a food supplement, but when they have it available at various times in the medical food version, then you can buy the Doctor's Biome in the medical food version, and all you need to do is take 1 2-ounce shot a day, and it is delicious because the bacteria are living and growing in a 100% organic mint kale lettuce, celery, cucumber, apple juice. It has virtually no sugar and zero alcohol. It's not fermented. It tastes great. Children will love it, and children get Lyme disease. You can get it gestationally. We've treated one case of gestational Lyme. It means the child was born with it, got it from the mother's blood. Um, and so in any case, you can give it to babies. So you can do Doctor's Biome in the food supplement version. We recommend it twice a day, once in the morning, once in the evening, at least a half hour before you eat. You go to doctorsbiome.com and remember to put the code radio20 in. I believe they're still giving you 20% off the first order. I got that wrong at the beginning of the show. Later on, you could go on auto ship and get 10% off subsequent orders and cancel anytime. They 100% money back guarantee. You have to be able to take it and like it. Very often, Lyme patients have constipation or diarrhea. This will reverse that. Sometimes if you're constipated, get diarrhea for a few days. Sometimes if you're diarrhea, you'll get constipated for a few days. In any case, this will reverse it. And normally you just start getting regular again if you weren't. You need to be well hydrated. This is important. The human body is over 70% water. When you're not feeling well, you're not drinking enough. You need to drink, based on your size, at least 3 to 4 liters. That's 3 to 4 quarts of water a day. I want you to take vitamin C for this. Now, vitamin C in Lyme disease can cause severe herxing. So you may have to use the powdered forms of vitamin C and take minute doses. That's okay. Remember, now that we've repaired your gut with Doctor's Biome, you'll be able to absorb it. And if you herx from it, then you just have to reduce the dose. And that's where the buffered powdered forms of vitamin C become valuable, because you can use little bits at a time. But here's the catch. You have to take it 5 to 6 times a day. 5 to 6 times a day, no less. Okay. Now, you can take any supplements you want that can cleanse, detoxify, or boost your immune system, keeping in mind you may herx from them. And that's what a lot of the LLDs give you, is a lot of supplements to take. Let me just say, you can be on any pharmaceutical with what we're going to be telling you when we come back from the break. You can be on any nutraceutical, unless you want to spell it nutraceuticals, vitamins, minerals, herbs, homeopathy, Ayurvedic medicine, Chinese medicine. It's valuable to do chiropractic every week, because if your back and spine are not in proper alignment, you will not get the right nerve innervation to all your organ systems, and they all interact with your immune system to make your immune system work. So I believe that weekly chiropractic adjustments or osteopathic adjustments are valuable and necessary when you have Lyme disease. You can do acupuncture. You can do every other therapy you want with this, because it's that important. This is a life-taking disease. What we found was that almost any method of ozone therapy, particularly, and we're now going to be talking about intravenous ozone therapy, is what's necessary to effectively treat Lyme, as Lyme cannot resist the destructive nature of intravenous ozone. What we're going to do is go to our last break. When we come back, we're going to talk about the different methods, how they work, and what you need to do to get rid of it. I see so much Lyme disease. It's sad. The people have been suffering for so long, and when they come to us, this is their hopeful last resort. They're hoping that we're going to be able to help them. They've tried everything else. They finally uncovered that ozone therapy exists, because they didn't give up. And they come in, and the good news is we're able to help them. And that's the most important thing in almost every case. Sometimes it's too late. Um, Sometimes the reactions are very severe in terms of the herxing, the kill off. So we have to deal with that. You can even get herxing from the doctor's biome, though we haven't really seen it yet. I predict that it can happen because it's going to kill off Lyme bacteria in your gut, and you have to be able to eliminate the waste. Maybe you don't herx from it. Like I said, I haven't seen it yet, but I do believe it's very, that it's possible. In which case, we have to adjust the dosage of Doctor's Biome. You don't take a whole 2-ounce shot. You can take a portion of it. People know who use it that they can contact the company, and that I will be happy to speak with them and help them with how to dosage it right and how to deal with any issues they may have, so that they can stay on the product literally for the rest of their life. We're going to talk about intravenous ozone therapy. Now, home care ozone therapy, before I talk about intravenous ozone therapy, is where you would be doing rectal insufflation, an ozone enema. You can also be drinking ozonated water. If you go back in episode directory here on Voice America, you can listen to our shows on home care ozone therapy, and it goes over all the details on how to do it and what to do. Also, Promolife, if you call them at 888-742-3404, or even go online, they have videos explaining how to set up and do home care ozone therapy, which is making ozonated water and drinking it every day, doing rectal insufflation so you can absorb some into your blood, and doing for women, vaginal insufflation. They claim that it can get into your lymph system that way. Also give you a healthy pap smear. So don't hesitate to contact Promolife at promolife.com at 888-742-3404. Now, all forms of intravenous ozone therapy are beneficial against Lyme disease. Unfortunately, the commonly used weaker versions, for example, ozone and saline. This is where they start a saline, a saltwater, IV saltwater drip. They shoot the gas into the bag and they let it drip into you. Minimal benefits. You will possibly have Lyme for the rest of your life or die from Lyme because it doesn't seem to get rid of it, in my opinion. Then there's major autohemotherapy. This is where we take out a certain amount of blood. We used to do 300 cc's. I did 45,000 of them, by the way, between 1990 and 1995. That's probably more than any one clinic in the world. And I stopped doing it 29 years ago. Helps everything, gets rid of nothing. Even Dr. Bacci agreed with that. But it does help with Lyme disease, improve your symptoms, just won't get rid of it. And you're not coming to us to get better. You're coming to us to get rid of it permanently, completely, once and for all. And there is no average, there is no typical, and there is no usual number of treatments ever. And by the way, no moral and ethical or honorable doctor should ever promise or guarantee a result anyway. I don't care if I was successful 10,000 patients in a row. You never know what's going to happen on 10,001 for some reason. But we've seen nothing but success with this, and that's what I expect to achieve. Now, in major autohemotherapy, today they're using 150 cc's, and they're using lower concentrations. Virtually, blood comes out of you like if you were donating blood to a blood bank, and then you ozonate it, and then you slowly drip it back in. Another method is called ultraviolet blood irradiation, UBI. We use the state-of-the-art Hemolumin machine, but there are other machines that can help and be beneficial by themselves, minimal benefit against this. Now, they sometimes combine major autohemotherapy with ultraviolet blood irradiation. So as the blood comes back in, it passes through the UBI machine, and that adds more ozone to it on all the ozonoids, um, the alkenes, alkanes, peroxides, peroxyls, super ions, anions. Remember, it's the extra O in the O3, the ozone, that does all the work, killing these bacteria and spirochetes, as well as every virus, fungus, yeast, and mold and parasite, other parasites and toxins that are in your body, and harmful free radicals. So it's not just doing one thing, it's doing many things. And it's not a guided missile. You can't whisper in its ear, go after Borrelia today. Leave Babesia and Bartonella alone. It has to go after and kill whatever it meets first, second, or third. And that's what it does. This is a marathon to treat it. It is not a 50-yard dash. Fortunately, many people start to feel better early on, but that's not the common. The common takes some time, where you need to do these IV therapies at least 3 times a week, minimum, to get well. Now, the major order hemotherapy is used all over Europe, all over the US, some in Central America, some in South America, but not all over the world. The number one method used all over the world is called direct IV, DIV, direct intravenous ozone therapy. My version of it is called RMDIV, Robbins method. We've learned how to push the envelope safely so that we can get you well without herxing you so severely that you can't deal with the therapy. And the best part about RMDIV is that it's completely adjustable. Everything about it can be adjusted. The concentration we use, the amount we give you, the speed we push it in at, which arm, which vein, how many times a day or a week. Unfortunately, Lyme patients can't do what we call fast track. That's 2 or more treatments a day, which we separate by 3 hours. The herxing is just too severe in most Lyme patients. And you never know when the second treatment is going to hit you like a ton of bricks. But fortunately, these are short-lived reactions. We get everybody over it, and we can adjust the medicine to make it more comfortable for you. We take Dr. Do No Harm very seriously, but that doesn't mean you won't herx. So we have to adjust the medicine to minimize that as much as we can. And fortunately, we are able to. And we could often have to adjust the concentration downward. And then after doing this, we build you back up very often to the full concentration. Remember, the minimum is 3 times a week. It's just medicine. Normally, when you have a medical problem that's pretty severe, you would take medicine for it every day, usually several times a day. Now, the Global Lyme Alliance did a study that was one. I'm not sure if I can mention who won it yet. They're going to be publishing this year, but it was a major medical school's research department. They first did it on mice, and for a reason, showing not does ozone work, but how does it work? What is the mechanism of action that kills off the Borrelia burgdorferi, which will be the same for all the other co-infections. Now we're going to be doing, and I'll be going out hopefully sometime later this year to Oregon to a primate research center. I'm not a big fan of giving it to animals, particularly primates, but apparently this is what the FDA requires to make this a standard of care treatment in this country. So they will test it on primates first to prove its safety. Thank God it'll be done in a safe way. And then what I have been doing for 34 of my 50 years as a doctor, human trials, people. And then hopefully they'll get that FDA approval as an effective treatment for Lyme, particularly for people who are allergic to or can't take antibiotics. And more importantly, where the antibiotics have completely failed, where they become allergic to it, or where they just develop resistant strains to the antibiotics, and now none of the latter generations of antibiosis works. But ozone is foolproof that way. Now, we do another method of intravenous ozone therapy along with DIV. Now, all my patients do DIV to begin with. So we start to clean you out gradually. And then those that have big and strong veins, we are able to do a method called HBO3, hyperbaric high dose ozone with multipass. I like to call that RMHBO3. That stands for Rowan method. My buddy Robert Rowan out in Santa Rosa, California, who seems to have perfected this method. And this is whereby we use a Zatzmann machine, which comes from Germany, which is able to create in a glass collection bottle. We don't like to use the plastic containers for this. It sucks out in a vacuum, like you do when you get a blood test in those little vials. 200 cc's of your blood. That's quite a bit of blood. And it does it in just a couple of minutes, which is amazingly fast. Then through the machine, the blood gets ozonated with 14,000 micrograms of medicine, of ozone. That's a humongous amount of ozone. And this gets forced into the blood because a hyperbaric, a high pressure chamber, is created in that glass bottle. So you're not in a chamber. It's the bottle inside the collection container for the blood that is the hyperbaric chamber. This forces the gas into the blood and the blood back into your body. Now, this used to be all that was done. And then Johann Lahadny out in Austria, close friend of ours, came up with the idea, why stop? Let's keep doing it. And blood would go in and out, and he came up with what we now call on the internet, its nickname is 10 pass. Blood would pass out of your body into the container, ozonate it back into you. That whole process takes 5 minutes. Used to be just called a treatment and be done with. Done in Germany, done in many places in the world. 10 pass is where the blood goes in and out 10 times. So about 2,000 cc's of blood, about half the blood in your body, okay, third of the blood in your body, has now been ozonated, and the ozone, 140,000 micrograms of medicine have been put into your body to kill off these infections. And I've seen, when I did this, patients right in the middle of the treatment have all their brain fog and brain cloudiness and everything just completely disappear. What makes our clinic special is we combine the two, because that method requires, all the blood methods require blood thinners. And with the blood thinners, there's issues and reactions that can happen. You have to use heparin, sodium citrate, which is even more risky. In any case, there's risks involved, but if you have big, strong veins, it's definitely minor and small and worth it. And but it can only be done a minimum number of times a week. And right now, these organisms are growing every day. That's why we bookend both methods, direct IV ozone. I do the hyperbaric high dose. I don't let my staff do it. That's just, I enjoy doing it. I train doctors in it, and I train in how to deal with any issues that might happen during it. And then we bookend afterwards, the next day is the direct IV. So we combine both methods. We can add the ultraviolet blood irradiation method using hemolumin to it, state-of-the-art. Ultraviolet blood with other color spectrums, and we just get amazing results against Lyme. Just amazing results against it. The key is we have to treat you until all your symptoms are completely gone for an entire month. Then we diminish the numbers of treatments to 2 a week, then 1 a week, 2 a week for a month, 1 a week for a month, and then finally once a month thereafter. Patients ask, how long do I have to keep coming once a month? Until there is a test that proves it's gone, that we know we didn't just put it into remission, but we have completely eliminated it because we have had patients who claim they never got bit again, that came back in some years later with different but absolutely clear symptoms of Lyme disease. So the organisms took time to grow back and come out of remission and cause trouble again. Everybody, I want to thank you very much. If you want to contact us, call my office in Manhattan, 212 581 0101. 212, that's +1 country code, +1 212 581 0101. And I didn't even get a chance to mention how H.O.C.A.T.T plays a wonderful role at relieving your symptoms. Oh my God, listen to the show on H.O.C.A.T.T. You won't be sorry. H.O.C.A.T.T. What is H.O.C.A.T.T? Everybody, stay safe, stay healthy, stay well, and come back next week to Functional Medicine with Dr. Robbins. Bye now.